Amazing. Hi, so good to see you.
Great to see you. Hi,
Great.
everybody. Thank you for joining us.
Excellent. Yes. Hello, everybody. Thank you for joining and welcome. I guess, should we go ahead and get started or should we give it a few more minutes?
Yeah, we'll give it a couple minutes.
Yeah.
Maybe you and I will chat, and we're excited, just to give some background. Dr. Rachel and I follow each other on Instagram, and even though we talk a lot about social media being negative, this is the positive side of it, is that we got to connect, and I love seeing you and all the amazing stuff. Dr. Rachel was on for twice at least, maybe more,
Yes,
and
yes,
does
thank
lots of
you.
fabulous stuff. And we both realize that we both teach on faculty at NYU and have tons of stuff in common. So I'm happy to connect here and hopefully in real life soon too.
Yes, and same. And we'll officially do our intros in just a few minutes. But I feel the same way. And I always say, there's the positives and the negatives, right, of social media. And one of the best parts of it, I think, is this part, right? We get to meet colleagues and friends, and we get to connect with people from all over the world. Little did we know that when we connected, right, that we both have this affiliation with NYU and worked at NYU before. And Dr. Varma is doing such amazing things. I mean, I love that your book is right behind you. I was actually thinking about having mine of yours behind me also. But so good. And I know you'll talk about your book as well, but doing amazing things and just lots of good stuff going on around here, which is
Thank you.
excellent. And I love this question that actually the Perry team wrote, because I wanted to start with that as well and kind of ask. So while we're waiting, we'll give it another minute, but how is everyone's health anxiety today? 0 being the lowest and 10 the highest. If you want to go ahead and put a number in the chat, it's a great place for us to see where everybody is. So good, I see
And
those
I
numbers
love
coming
that. Like
in.
when I check in with patients, I'll often ask them, like, on a zero to 10 scale, both how is your mood, with 10 being the highest,
And
and then 0 being like, I don't want to get out of bed. And then with anxiety, 10 being the highest and 0 being the lowest. And that's really helpful, every session, just to get a check-in, to be like, then I get a sense of something must have happened this week,
exactly.
and we can gauge sort of week to week what's working and what's not.
Yeah, I love that. And, I always go back to this idea, and I say this to my clients, that's the data, right?
Yeah.
And even if somebody isn't seeing a healthcare professional, psychiatrist or psychologist like myself, like us, I bet, you could do this with yourself, right? Like kind of wake up in the morning and be like, how am I feeling today? On a scale of 0 to 10, how's my anxiety today? How's my mood today? And I think it's a really good check-in that people can do with themselves and then identify, okay, what's different, right? Like, why is it, like I saw like some 8s and some 6s and 5s coming through, like what's making it different today? Do I know, is there something going on that's making me a little more anxious? And I know we'll get into a little more of that in just a bit. So
And that the connection between our mood and anxiety, and we can get into that, how sometimes the more anxious we feel, that might lower our mood. So we'll talk about that.
exactly. Yeah. Should we go ahead and start with some more formal introductions, although not formal? Do you want to
Yeah.
go first?
Okay, sure. Yeah. So I'm Dr. Sue Varma, and I'm a board certified psychiatrist. I started my career many years ago as the first medical director of the 9/11 mental health program, and where I was treating civilians and first responders. And I've always been fascinated in the concept of resilience. And a key component of resilience is optimism. But I never got interested. Nobody did, because we thought it was something you were either born with or you weren't. And later, research would show that yes, there is a genetic component. It's actually the oxytocin receptor gene. And we've all heard of oxytocin as the cuddle hormone, the bonding hormone with babies, with loved ones, with partners. But what it actually codes for is a bunch of skills that we can all learn. And as cognitive behavioral therapists, we know that, there are so many things that tools people use in therapy, but the problem is most of us are not going to get to go to therapy for any number of reasons, or, like the accessibility, the affordability, connection with the right therapist. So I really wanted to make a lot of tools accessible through the lens of optimism, because we know that people who have optimistic thinking practical optimism, which is practicing it like a yoga, like a language, they're more likely to live 20% longer. They're more likely to get a raise 40% in the next year. They're more likely to have longer and stronger friendships, partnerships, less anxiety, less depression, less headaches, less all sorts of problems. So, I think when I studied then, what are the characteristics of these people? There are 8 things that they do really well, from having a purpose and an intention in life in their day to practicing healthy habits to being able to process their emotions. And we'll be talking about how do we deal with anxiety and what are the types of thinking that lead us down rumination, pessimism, depression, and how to catch it early on. Because some of us, anywhere from 5 to 10% of the population will have generalized anxiety disorder or any number of anxiety disorders. But regardless of whether you have an anxiety disorder or depression, all of us, I always say, there's this saying that 1 out of 5 people will have mental health disorders, but 5 out of 5 people will have, sort of mental wellness. If 1 out of 5 have mental illness, 5 out of 5 will have mental wellness. So now I'm in private practice. I still teach at NYU a variety of courses over the years. And I speak on television for the last 15, 20 years. It's sort of been a parallel career on Good Morning America, Today Show. And part of that is just bringing a lot of these tools and making them accessible. I mean, we only have 5 minutes in those interviews, and so you have to speak in sound bites. So that's why I wrote this book, which initially started out being 3,000 pages, if you can believe it, years of research, and then cutting it down to 300. So it's long. I hope you all get a chance to read it. I narrated the audio version, so you can listen to it if you're walking or and done tons of podcasts, and hopefully you'll get a lot out of our conversation today. So thank you all for having me. To the Perry team, Dr. Rachel, excited to hear about you and then jump into the conversation. So thank you.
Yeah, and I love everything you just said because we have somewhat parallel-ish careers, I think, and very similar in CBT, which we'll get into that as well. So everybody might hear a little bit of overlap, but a little different, of course, as well. So I'm Dr. Rachel Goldman. I'm a clinical psychologist here in New York City, also affiliated with NYU Grossman School of Medicine. I worked at Bellevue Hospital, actually, straight out of my postdoc. And similar to you, Sue, I was not a medical director, but I was the first behavioral health professional in the weight management bariatric surgery department several years ago at this point, and was there for 5.5 years. At the time that I was there, had built up that program to see patients doing lots of different groups related to disordered eating behaviors, body image struggles, emotional eating, things like that. Left in 2016 to do my private practice, partly because of what you just said. I felt like I had all these messages and these tools that I wanted to get out to a larger, broader audience. And I couldn't do that, unfortunately, seeing one patient at a time in a closed door in a large, hospital setting. So I created my private practice and feel very fortunate that about half of my private practice is doing, clinical work and seeing clients. And about half of my private practice is doing media and consulting and advising and also teaching at NYU. I do cognitive behavioral therapy as my specialization, which sounds like you too as well. And I supervise psychiatry residents in doing CBT with their patients. So I have, as Sue had mentioned, I was on Oprah twice recently, and I actually consulted on a film and lots of other exciting things. And I have a book on the way. So for the same reason, like we have all these great tools and we want to get them out there because not everybody has access to us. Not everybody has access to therapy. And that's why I love doing these types of interviews and these podcasts and these webinars, because we both have so much information that we want to share with all of you. So that's why we're here. So, and I want to add, I'm also a mom. So I have 2 young children. One is 5 and one is going to be 1 in like 10-ish days. So I still breastfeeding. So I'm going through some of all those hormonal things that we're going to talk about too. But I like to add that as well, because I think that's an important part of who I am. And I think puts kind of a different twist on things as well, knowing that, maybe I'm going through something similar but different than some of you as well.
Love it. Yes. Yes. I'm a mom too. I will add that.
Love that. Yes. So yeah. So Sue, do you want to start by talking a little bit about perimenopause, or anxiety overall, and then we can kind of take it from there and then get to the questions.
Yes, yes. And, so we're talking about health anxiety, but specifically in the perimenopausal period. But, we can sort of broaden it to say that, health anxiety in general is a variety of things. I think that it can mean different things to different people. It can mean I'm worried about my health. It can mean that I have symptoms, but I'm not sure how serious they are. I'm worried that these symptoms could mean something very morbid. It could often present in the form of unexplained physical symptoms, and I open up my book talking about my own anxiety and health problems, and recognizing in the end that a lot of times our body expresses what our mind cannot. And so we have bodily somatic manifestations of anxiety. We're not able to express it in the moment, and it comes out in the form of literally head to toe. You can imagine insomnia, headaches, people having frequent colds and infections. So anxiety manifesting as health problems. But one thing I want to say, and I always tell this to my patients, never dismiss your health problems and just chalking it up to anxiety. I always, like, this is where the beauty of being, for me, when I knew I wanted to be a psychiatrist, I wanted to go to medical school so that I could have that understanding of the body and how to treat patients when they have medical problems, but then also being able to be that liaison to be like, okay, this is where it now is above, the scope of what I do, and I'm going to refer you to a general practitioner. So I order baseline labs on everybody. If someone is like, I'm feeling like I've gained a lot of weight and I'm having trouble sleeping at night. So I'm thinking, okay, maybe thyroid issue. So in the beginning, I'll often get labs, and I'll say to people that if you are concerned, please get it checked out. So I don't want anyone to ever feel dismissed or minimized. We know that in the perimenopause period, which can be like up to 10 years leading up to menopause, where you're feeling a variety of things. Like a lot of women will say it started out with mood changes and irritability, and it kind of feels like PMS. And irritability is the biggest thing. Irritability I hear, and tearfulness. I don't know what's going on. I should be happy. Things are going well in my life. Things are going well in my marriage. Things are going well in my career. All of those things. And weight gain. Like these are the two things. So it's interesting I'd love to hear from you in terms of specialty. Maybe even though it wasn't one of the questions, but it's a question I get a lot, where women are feeling demoralized, where they're like, suddenly I'm having fat, going on in places, and I don't know my body anymore. My breasts don't feel the same. Like nothing feels the same. Their interest in sex may be different. Because of hormonal changes, estrogen levels dropping, sex can feel painful, and, like dryness. There's a variety of things from head to toe, sweating, overnight, and feeling like wherever you go, you're sweaty, and just not knowing what the hell is going on with your body. And I think what's so interesting is that for women, a lot of times the transition into like the childbearing ages, and you feel like I finally just got back to who I was and having some semblance and control over myself and my body. And now what is this? Like, so how do you go from breastfeeding to menopause? Or a lot of women are in the perimenopause period and trying to get pregnant, in their 30s. Mm-hmm. And so I love that there's so much awareness. People like women in their 30s can be experiencing this, and that's not something that doctors are equipped for really at any age. They're not even equipped to talk about menopause. So anyway, there's this general idea of health anxiety, and I definitely want to get into, there was a question, and when we get to the questions, we want to talk about how do you know when it's serious, because a new study came out this week, and I've been talking about it, cardiac problems in women. So we want to really make sure that we drive that home. But please, if you're having symptoms of palpitations and cardiac, do not dismiss it as panic attack. Get it checked out, and get it checked out on the earlier side. So we're going to get into that, of the correlation between anxiety and heart problems.
Yeah. And I love what you said in terms of like, you always, order the labs and encourage your patients to like ask those questions, right? Because that's something that I do a lot. And I think for everybody listening, it's really important that we are our own advocates, right? So, in so many times, like what I say is, you are the expert of you. I'm the expert in terms of what I do. I'm a CBT expert. We're both experts in psychiatry, psychology, related behaviors, things like that, thoughts. But you are the best expert of you, and you know your body, and you know what feels different. And I think that's the really scary part of, menopause and perimenopause, is that these changes just happen so suddenly. And it's like, whoa, what's going on? Like you said, like I should, whatever should is, right? Like I should be happy. I shouldn't be stressed. I shouldn't be anxious. What's going on? And what I often say is we live in this world that is so go, 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 right? Like that glorifies us being busy. Like we should be busy, you should be busy, all these things. The problem with that is that our body is often giving us signals that we miss because we are so on the go, right? Or, oh, I have a headache. Oh, it's fine. I'll pass. I'll go to sleep later. I'm just tired. No, actually, your body is telling you something, right? Most of the time it's telling you it's got to slow down. It may be you're not getting enough sleep. You're not getting enough nutrients. It could be your hormones, right? Fluctuating because of what we're talking about. But our body is constantly giving us signals and we often dismiss them. We often ignore them. If you get nothing else out of this talk, I think from both Sue and I, we're saying, don't ignore those signals, right? Listen to them. But then there's that fine line, right? Like, is it health anxiety? Is it anxiety? Is it a normal reaction to stress? Is it a normal reaction to menopause? And that's where it gets a little gray and uncertain and unsure. And that's what we're here, hopefully, to help you kind of figure that out. But don't ignore those signals. Talk to your doctor, ask questions. There is never a stupid question, right? And if you're feeling something, tell your doctor. And if your doctor is dismissing it or you don't feel like your doctor is hearing you, that could be a sign that you need a new doctor, to be honest, also. It's really important that you have doctors that you trust, that you feel open with, that you can, be honest with. But ask the right, ask the questions, not the right question, ask the questions. And I think that's really, really important. And that's why this can be really scary, because anxiety there's physical sensations and symptoms that overlap so much with other conditions and more serious illnesses, not to minimize anxiety, but more serious things that could mean it's time to go to the hospital or to really see your doctor.
Yes, no, that's great. And I would say even like make a list of questions and book an appointment sometimes, even if you don't have any immediate, because that's the problem is if we wait too long and we wait until things are like the other shoe drops or like super broken. And I would say think of like good by the time you have symptoms. And again, I don't want to sound doomsday here because clearly like I'm talking about optimism and that's like my thing. But practical optimism is different, right? It's not this toxic positivity of everything will be okay, like you said, the headache and whatever. People who are practical optimists, they are proactive, they take health in their own hands and they don't wait too long, right? And so that's the mistake I think that I had made early on. And I was like, okay, no, like just like you said, I love what you said about the signals, take it as a cue. And as busy women, as busy moms, as caretakers to our families, we do not make time for ourselves until things are broken. And so I would say if you're like 50-50, you're like, yeah, maybe something. So you know what, I'm going to make the appointment at least, because it's going to take you 6 to 8 weeks to get that appointment.
Right. Oh, oh yeah, you're still there. I don't know what happened. Wait. So, oh yeah, okay. I don't know. For some reason okay. And what I wanted to say also is mentioning self-care, that I actually want to commend all of you for being here, because this is a form of self-care. You blocked your time, even if you're doing something else at the same time, totally fine. But you decided to show up today to listen to this, and that is a form of self-care. And that's really important. And that's what we're talking about, right? It doesn't even need to be an hour blocked out of your day. I like to think of it as little moments throughout the day that we take care of yourself. Like, honestly, this is one of my biggest acts of self-care. Like having my coffee, making it and enjoying it, that's a form of self-care, taking a step outside, breathing, but showing up and doing this, making that doctor's appointment is self-care. Going to the doctor is self-care. And it's so important. And, and what you were saying, Sue, was like, you don't want to be negative about it. And I kind of giggled because I'm the same. I always tell people, when you actually have the pain, it's not that it's too late, but your body was probably giving you signals leading up to it, right? So for instance, we all probably have like tension here, right? And like, if we don't address it, eventually this is going to turn into a headache or jaw pain, right? So I think that's so important. And I often say that these moments of self-care can also be moments to assess ourselves. So like we did earlier, like let's check in with ourselves. How are we feeling today on a scale of 0 to 10? You can ask yourself certain questions every day. And I even say multiple times a day, like, how am I feeling? Which is sometimes a really hard question to answer. So if that's difficult for you, it can be, what's working? What's not working? What do I need right now? Like, I might need water. I might need to get fresh air. I might need to call a friend and have support. And those are just some simple questions that we can kind of check in with ourselves on a regular basis, which is going to give us the answers to know, what do I do next, right? Maybe you're feeling like, maybe you turn inward and you're like, wow, like I'm really feeling anxious. I'm feeling sweaty in my palms. Like, okay, that's a sign. What can I do about it now?
Yeah. And it's like it's something I want to say, and I recognize that I might be opening a can of worms here, but it's like something that I want to say to women, and maybe this is a part two of another conversation later, but I want to add, in addition to that, doctor's appointment is therapy for yourself and also couples therapy if needed. When I every few months I'll go to my hair stylist, and we talk, and she's like the therapist of the town. She'll tell me, like, everyone tells me their secrets. And I was like, oh wow, what do you hear? And she's like, I hear how, like, a lot of women are struggling in their marriages because they feel like they're doing everything for the family, like that their partner is not rising to the occasion. And I feel like a lot of women midlife start to realize, and it doesn't have to be midlife, but the assumption is that you've been with your partner for some period of time. Maybe you're raising a family together, and you don't have an equal partner in the relationship. So this is a completely different topic. But why I'm saying it is that when you mentioned how am I feeling, I think a lot of women bottle up their emotions, and this came out in a research study today. And again, not to be negative, but this is what we do: is we put out the stats. And it said that if women, when they bottle up their emotions and they don't express it, regardless of how happy or unhappy, it had nothing to do with marital satisfaction. Bottling up your emotions for women leads to 4 times more likelihood of death in the next 10 years. And I'm saying this to say, this is not just like, oh, feel good thinking, let's talk about our emotions. No, there's science behind it. And the interesting thing is, men who bottle up their emotions doesn't affect their health at all, right? So they studied this in married couples. It was like a few thousand married couples, and they followed them over a period of time. So there's science behind the consequences of bottling up your emotions, which can lead to all the physical symptoms, to the head anxiety, the health anxiety. And I would say a lot of times women avoid the question about how do I feel, because you know why? It makes them realize that they have to make real changes in their life, not just with themselves. They have to have difficult conversations with people that they love. It could be even a parent that they're caring for, like a parent that's not taking care of their health, a parent that might be drinking too much, so or a sibling. So a lot of times women say, like, I end up when I'm angry, I end up crying because I don't know how to express myself, so I bottle things up. So this is, I know, a bigger conversation, but we want to give you permission to feel what you're feeling. And yes, that might be difficult, the next step, because it means you have to face things. It might mean a lot of things. It might mean having to distance yourself from certain people, or coming to recognition that they don't want to seek help at this point. So anyway, that's a whole different thing. But women's health, physically, psychologically, is very related to the status and nature and quality of their relationship. So it would, I would be missing something really big to not mention the importance of cultivating and really recognizing troubles in close relationships and trying to address them head on through therapy, through conversations.
Yeah. And I love that you mentioned that about the couples, because I think when people are experiencing, say, menopause or going through perimenopause and are feeling off, right? Like I think we could just kind of label it for a moment as feeling off. Like, I feel like something's not right. I think this is a really great time to go to your partner, right? And to be honest and say, I'm not feeling my best. Like, maybe we blew up at something yesterday. Maybe we were reactive, right? I always say about the difference between responding versus reacting. Maybe we were irritable. Maybe we felt like this didn't feel like me. But to be honest, be like, I'm not sure what's going on. Maybe I'm going through menopause. Maybe I'm going through perimenopause. Because I think our partners need those reminders. And I'm saying this as I'm like thinking about my own life, to be honest, as well. Like, they don't know. I mean, I actually posted something about this today. Nobody knows what we're going through unless we tell them, right? I often say we don't have Post-it notes on our foreheads, walking around, sharing our struggles. Nobody knows. This is all they see. That's it. That's it. Nothing else. Even our partners, right? Unless we open up, nobody's a mind reader. So we don't have to share and blurt out our news and our struggles with the whole world if we don't want to. But I think really being honest with your partners, obviously with your healthcare professionals, with the people in your life that you see on a regular basis, can be really important, because we need that support. As much as we think we're Wonder Woman and Wonder Moms and all these things and super, we are, and we're also still human. right? And
Yes.
humans have emotions and humans need support, and we all do. So I think that's really important that we open up and we share our struggles. And if you don't feel like you can turn to your partner about that, find it somewhere else. But I think if we can be first honest with ourselves, right? Acknowledging, wow, I might be going through perimenopause. I might be having some health anxiety. This might be anxiety. This might be depression. Then where can I seek support? Because nobody can help us if we don't share this information or if we don't ask for support. And I think that's what I also wanted to come back to for a moment and let everybody know that, you know, whatever you're feeling is your feelings. It is valid, right? Nobody can tell you you can't feel that way or you don't feel that way. That's how you feel. And once again, if somebody like a healthcare professional is telling you differently, that's probably not the best fit for you. But it's really important to remember that, and that this is all normal, right? These symptoms that we're talking about are normal reactions to going through this stage of our lives. You know, anxiety is a real thing. You know, you're going to be feeling these different sensations and these different physical and mental symptoms that we're talking about. So you're not alone. Lots of people are going through it.
Yes, right. Can we get into the questions?
Yeah, let's do it. And if anybody has questions, I know they're putting it in the chat also, so feel free to write questions, but I haven't seen any come in. So we would love to hear from you as well. These questions, you know, we're on from the community. Maybe some of you are here now, maybe you're not, but we want to also be talking directly to you. So if you have specific questions or comments, you know, please put them in there and we will 100% make sure that we get to them.
Great. So I think we answered a few of the original questions, but you know, just to say them again, what triggers health anxiety and do hormones play a role in this? So absolutely, like a drop in estrogen, life transitions, you know, whether it's raising children, whether it's empty nesting, all sorts of things are contributing to the health anxiety. Having physical symptoms that you don't know what to make of them be very upsetting. You know, then there's quite a question about how can I stay positive in this very rocky perimenopause period. And there's questions around what are the tools to manage it? How do we navigate the changes? How do I start feeling like this? I'm hearing a noise.
Yeah, if everybody could mute themselves, sorry, if you have questions, please put them in the chat box. Yeah. Oh, thank you.
So there, you know, a lot of the questions then came about like, how do I solve this? How do I deal with it? How do I cope with it? What are the tools? So, you know, once we've sort of like described what the problem is, health anxiety could be any number of things related to hormones, life transitions, and or medical problems that are individual and unique to you. So I really do think having the annual visit and following up with all the screenings, because you know, what I'm seeing is some of my patients hesitate. They're like, I don't want to know. Like I'm thinking of one woman who would really delay getting mammograms and you know, what you're supposed to be doing at a certain age because she's like, I don't want to know. And so we would go back and forth of with knowing how to be helpful and how could it be helpful. And here's the thing is one key piece of anxiety is that in anxiety, right? First of all, I always want to normalize and validate and say they're never about like random, like, oh, like somebody landing, is there a Martian landing on Earth, right? They're never like these bizarre out there things. They're all within the realm of possibility. So I get it why a person would feel that way. They're normal things that they're worried about. The second thing is we overestimate sometimes the danger associated with it, and we underestimate our capacity to deal with it. And what we want to do is shrink that gap and say, all right, what is the likelihood of this happening and reducing it? Because somebody's like, oh, it's 10 out of 10 going to happen. And you're like, let's do like this probability analysis. And then it gets a lot lower. And then looking at how do we boost our own self-efficacy and confidence in our ability to handle it. So troubleshooting about going through the steps of like, if I did find out something bad happened to me as a result of this annual screening, what would I do? What would the steps be? What would the support? So kind of walking yourself. It's kind of like when you took a big exam. I don't know if people did this now. Everything is like at test centers and computers and paper and pen. But when I was taking the MCATs, they told us go the day before, go see what the site is, you know, and like maybe you could go in, maybe you couldn't go in, but at least it's just familiar, right? So walk yourself through mentally the steps of like what would happen next and who would the doctors be. And like this is why I think it's so helpful to talk with friends who are going through and being very open and honest and sharing resources like, oh, this is the best doctor. I mean, that's how I found my OBGYN, because she was highly recommended through friends, and it was like the best thing ever. So speaking about questions and challenges and getting information, that is a big part of self-efficacy. And then being prepared and knowing what you're going to do steps wise is a big part of dealing with health anxiety.
Yeah, I love that you mentioned like going the day early, right, to get familiar, because something that I really want to point out to people is that the more that we avoid, the more anxious it actually becomes, right? So we're sitting with it, and then our mind just starts racing, right? So we start all of that, and I know I see some of the questions coming in like catastrophizing, right? So like you're sitting with this, and now all of a sudden your mind is jumping to worst case scenario, and that happens, right? It's all those what ifs. But for a moment, let's think, what if that's not the case, right? I had a client, similar situation, needed to go for her mammogram. They found a little something, had to go for like an ultrasound, and literally like, worst case scenario. And I remember we were prepared for it, just like what you had mentioned. So, and I like to kind of remind people, exactly what you had said, but I'm going to like just simplify it for one moment. Examine the evidence. Where's the evidence that it is worst case scenario, right? And then you go through the likelihood, this, that, and then, okay, what if it is? What am I going to do about it, right? Focus on what's in our control. If, that's one thing I always say, if you can't do anything else today, focus on what's in your control. If the mammogram or the assessment or the test is in a month from now, we can worry about it and worry about it and worry about it for a whole month, or we can say, you know what, and it's not easy. I want to actually go back for a moment and remind people the things we're talking about today are also not easy, and we know that it takes work. Our brains jump to something. We all have these automatic thoughts. We call them cognitive distortions. It's like the should statements, the all or nothing thoughts. It's hard to retrain our brains, but it's possible, and it just takes time and being consistent. But if we're going to sit with this thought, and our brain's going to start jumping. So if we can go back, okay, what's in my control today? There's nothing I can do about it today. Maybe you can call to make an earlier appointment, right? So maybe you're not going to worry for a whole month, maybe a few days. But what's in my control today? I can have a plan, right? And that's going back to this like problem solving idea. Okay, worst case scenario, this, if not this, but what's the likelihood, right? Where is that evidence? And once again, it's not easy. We know that. But becoming familiar with it can help decrease anxiety. The longer you avoid it, increase it in anxiety. So great questions. And I want to go back to that one question because it was related to what you were saying, Sue. So I'm going to scroll up a little bit. Because a few people mentioned that they have this also, the fear that the symptoms, like every symptom is going to be cancer, every symptom, or having fear of the screening is because of that. So, and I would say, go back to that idea of examining the evidence, right? Like, is there a family history? Could it be? There's always the could. What's the likelihood? And then, kind of asking yourself those questions, and then thinking about what typically helps you de-stress or calm or feel less anxious. I think that's something a lot of people forget when people come to me. And so I'm sure you get this too. I feel like we all get this in the behavioral health field. Everybody on the first session wants like all the answers, right? They're like, cure my anxiety today. What can I do? And I always go back to this question. Well, what have you been doing? Right? What you've been doing is working a little bit for you. Maybe it's not the answer, but what works? What helps you be calm in the moment? If you can't call me, if you can't, call your friend, what do you do? And that's where I like to talk about having a coping toolbox full of tools that work for you. And, and maybe everybody can think for a moment and identify a few that they want to add to their toolbox, but you have the tools within yourself. It's about thinking about them. Yeah, go ahead.
Dr. Jordan, sorry to interrupt you. Maybe people can put in the chat what has helped them, because I'd love to hear some ideas, because we can all learn from each other. Like there are probably things that we haven't thought of. Like I want to know what works for you, what has helped, because somebody's talked about medications helping them. So I cut you off, but I want to just say that medications can be, when appropriate, one part of. I always say it's not the be all end all, because I see a lot of people who go to the primary care doctor and they might get medication, but they never follow up with talk therapy. And really what's going to have lasting change in your life beyond when you stop, if you did stop, is going to be the therapy and the resources and the skills and the tools that you've practiced. So that's really a key component. Therapy and lifestyle changes, the sleep, the exercise, which is huge, so much stuff. So sorry to interrupt you,
Yeah.
but I just want to say,
No.
put in the chat, and medication being one of those.
I'm so glad you said that, because I always say medication, therapy are definitely tools in our toolbox. If they are working for you, or if you haven't tried them, maybe it's a tool that you want to try. And in those tools, what I always say is we should have a minimum of 3. I always like at least 3 tools in our toolbox. The reason for that is if my go-to is running, which it is one of mine, and the weather's really bad, maybe I'll still run, but maybe I won't. But maybe I'm in a meeting and I'm feeling stressed and I can't just put on my running shoes and go outside. What am I going to do? Maybe another go-to is to call Sue, a friend. What if my friend's not available, right? So at least one of those tools should be something internal that you don't need anybody else for or anything else for. And I love it. Somebody just wrote breath work. Absolutely. I was just going to say something like breath work, a relaxation technique, imagery, mindfulness, meditation, a yoga pose, but something that nobody necessarily needs to know you're doing it. Like I could be doing it right now and you wouldn't even know. But it's really helpful to have that.
Back journaling, and there's so much
Yes.
research behind the benefits of that, like 2 15-minute sessions a week, and it could literally be anything you decide. It could just be like literally word vomit, and I often do that, and I'll like, and I've been journaling my whole life. I mean, here and there I've taken breaks, but even if it's just like 4 or 5 sentences, I can't tell you how much better it makes me feel. And it could be a variety of things. I think one is getting it out on paper. And, we can talk about the worry diary. And I remember when I first went to therapy, I thought it was ridiculous. I was like, why would I want to keep a journal of all the things I'm trying to get away from in my head? Why would I want to put them all on paper and remind myself? But what happens is you get desensitized over time. You see that the things that you worried about never actually happen. And there's a statistic that 85% of the time, the things we worry about don't happen. And the 15% of the time they do, we're better equipped to handle it than we gave ourselves credit for. So journaling is something you can do no matter where, and whether it's on your phone, if you want to take notes, or a small notebook to carry with you. But I love what you said, Rachel, about having 3 things and think of it as a toolbox. Put it on your fridge, put it on your phone, and the recognition of the anxiety is the first step. And then the second thing is, what am I going to do? So very quickly, as you acknowledge it, also then say, but there's things I can do. And the reason I like that is because then it gives you a feeling of being in control. And a lot of anxiety comes from a feeling of loss of control. It's not actual loss of control. It's a feeling of it. So like what you said about what is in my control, think of control. I am always in control, right? For like, even when you can't control the external circumstances, you're controlling your response, your reaction, your relationship to the situation. And you get to decide, how much am I going to allow this to bother me? What can I do about it? And asking for forgiveness is key. Asking for apologizing when you know you're in the wrong. Because a lot of times I think we burn bridges or we let resentment build. And our social support networks are our bomb. So we don't want to hold things unnecessarily between people, and then if you realize, no, I didn't do anything wrong, that's fine, let it go. You don't need to apologize for no reason. But I'm just saying that if you did something in a situation where you could take responsibility, that's also a key component of navigating anxiety and stress.
I love that you mentioned the worry journal and I call it a brain dump, but I think you said like a word vomit, same thing. Because I think that's really important for us to discuss here, because when people are worried and thinking and have that anxiety of what's this test going to be? Is it this? Is it that? What if this? What if that? What happens in our brains is that it's almost like our brain keeps hitting replay until we get it out. And we could get it out in therapy. We could get it out by talking to our partner, our friends, or support, or we could just jot it down, right? So, and usually these thoughts end up getting worse when we're by ourselves before we go to sleep, right? Like here we're just laying and we're thinking and the mind is racing with all of these worries and these thoughts that are probably never going to happen. So that's a really great time to do a brain dump. Like literally have a notebook next to your bed and jot down everything. Because if you don't, you're probably going to stay up at night hitting replay in a way, and it's just going to keep playing. But if you get it out, many times it's just getting it out somehow. And it's like, I'm letting it go. Sometimes I even tell clients, get it out and then rip it up, throw it away and throw it in the garbage. Like not only did you get it out, but you threw it away also. Once again, I know easier said than done, but the imagery part of that and the analogy of it can be super beneficial as well. And I love that people are also mentioning getting back to the gym. And I know, Sue, you mentioned a little bit of exercise before, and I wanted us to come back to that because I know both of us feel very strongly about movement. It doesn't necessarily have to be exercise, but movement, physical activity, exercise, etc. There is research that shows that it decreases anxiety and helps our mood and so many other things, especially if we're feeling off about our body. There's also research that shows that it improves body image. You know, take the weight part out of the equation. Forget about weight loss for a moment. Forget about all of that. Even if you don't lose weight, is what I'm trying to say, that it improves your body image by going to the gym and feeling stronger and doing something good for yourself. So a great tool to have in your toolbox is movement. Once again, it doesn't necessarily have to be exercise. It could be getting outside, taking a walk. It could be doing like home workouts, yoga, Pilates, anything like that.
I love that. You know, I often find that if there's a day when I don't have time for anything, even trying to fit in walks as much as possible. So like last night I was at an event and the train was way too far, but I was with a friend and we walked a couple of miles and it was a beautiful night outside. So I feel like as much as possible, trying to build in movement within the work
Okay.
day. You know,
Yeah.
if you're going taking the stairs instead of the elevator, all of that really helps. And I have so many patients who will tell me that if I don't exercise, like I'm off for the day. So the point
Yeah.
is, I want you to be on, and exercise is a big way. It increases mood, focus, concentration, you know, everything you can think of. And even a walk counts. And there's so
Yeah.
much more evidence and articles coming out about the benefits of walking. I'm seeing, somebody mentioned here CBT was life changing, and also that pushing themselves even when they feel apprehensive. And that's a really good thing. You know, we're talking about avoidance, and, you know, worrying is a form of avoidance where you think that you are doing something, but you're not. It's like the rocking chair that's like moving. There's like movement, but there's no acceleration, right? If I said, oh, you know, Rachel, you're 20 feet away from me, I want you to come over, you're like, I'm just going to sit in my rocking chair. And I'm like, okay, great, but that's not going to bring you any closer to me, right? Like you have to actually get up and walk over, right? So it's like that wheel spinning in the mud. So recognize that worry is either a form of avoidance or stimulation. And sometimes people are bored and so they start worrying. So what I would say is the actionable plan we were talking about with problem solving in the middle of the night. Let's say, you know, I went to a party and I said something and then I became really self-conscious about like, oh my God, that person's reaction was off. Did I say something wrong? Did I offend them? When it's 2 o'clock in the morning, I can't change anything about it. But it's helpful to even write down a couple of things to say, all right, A, it's in my head, but if it's really bothering me, then I can do this tomorrow. I can send a text message and say, hey, just checking in. I hope I didn't say anything, you know, whatever it is. So just giving yourself the possibility, allowing yourself the possibility that I could, if I wanted to, that might help because it's the helplessness that gets us feeling stuck.
Right. Yeah. And it's taking that step, right? And what I mean by step is not step in terms of the movement, but taking the action, right? So many of my clients, once they have that action plan, their anxiety decreases so
Yeah.
much, right? It's
Yeah.
like, oh, and what it is, right? Let's go back to the idea. Why is that? Because we feel in control, right? When there's no action, when I'm just sitting and waiting and I'm not doing anything, I feel out of control, right? And generally speaking, right? Your mind is just going. Also remember, thoughts are just thoughts, right? But once you take that action, once you come up with that plan, a lot of people feel less anxious because you're regaining that control that you just let go, so to say. And going back to that idea of getting away from that all or nothing thinking, right? Like Sue, I love that you described the, walking, because it can be 10 minutes. Something is better than nothing. It doesn't have to be an hour in the gym. It doesn't even have to be the gym. But many people are like, oh, well, the research showed this or that. Well, actually, research also shows even 10 minutes a few times a day, right? So I think that's a really important reminder that whatever you can get in is better than nothing. And once you start realizing, once again, turning in and being like, wow, that was actually really helpful, I feel so much better, that might give you the motivation to do even a little bit more. But for starters, just getting outside, just moving your body a little bit is going to help. And I actually have a client that when she doesn't exercise or do physical activity, she notices now she's so inward and so insightful that her anxiety is like off the charts, like the most anxious for her when she doesn't do that. And usually, and then we'll come to session and, she'll be like, I don't know why I was so anxious on Saturday. And she's like, oh, wait a minute. And, she's able to identify that. So I think that's really important for people to remember that, physical activity and movement, but also taking that action and focusing on what's in your control are like top tools and tips that we can give you today.
Yes, yes. And so if we were to talk about take homes, I think, keeping a worry diary is really helpful. Keeping a list of what those 3 or 4 or 5, welcome to populate as many, and really think about what makes you feel good. The movement, I mean, I call them the 4, it's a little bit different, but 4 M's of mental health. And that's movement, mindfulness, meaningful engagement, where you're connecting with someone on a deeper, more authentic level, and mastery. So something that you're good at. And you don't have to be a master to experience mastery, but it's just a state of flow where you're learning something. It could be a skill, a hobby, like think of like a child learning to ride a bike, right? It could be pickleball, like sewing, knitting, like whatever craft, golf, pottery, planting that interests you. And the idea is that flow states are almost incompatible with anxiety. You can't be anxious when your mind is focused on doing something. So every day, if you have time to spend 10 minutes on each one of these to say, this is my list, this is my prescription. I have a lot of patients that I do, even though I am a psychiatrist, and yes, I can prescribe medication. It's not my go-to for most people, because I do think that and also I want to help people, empower them with skills that they can take, that they're not doing, that they can do on their own in between therapy. And also at some point, I want them to not need therapy, like, so that they can go on and be like, I feel good. And they can come back, the door is open, to come back later if and when they need it. But the idea is that helping them graduate to I feel good and better, and also understanding that sometimes for some people anxiety never dissipates, right? It just lessens, the volume goes down. And also, again, talking about medications, there are a lot of something you have to talk about with your doctor, but SSRIs, SNRIs, yes, there are side effects. That's why it's like a cost benefit analysis. Some people will say it was life changing, when it worked. It takes time to work. It takes 6 to 8 weeks to work. And then when it does, there can be a lot of side effects. So I'm not dismissing and minimizing. That's why I don't think medications are the panacea. But I do think that for some people, if they're like, my anxiety is unmanageable, right? I can't focus, physical health symptoms, you name it, right? Or depression. Depression often goes hand in hand with anxiety. My mood is really low. My anxiety is so bad that it's causing me now to be depressed. There's something I wanted to say about the heart disease, and we have learned, like, this big study came out of 77,000 people. They followed people for 10 years. And what they found is that anxiety and depression elevates the risk for cardiac disease in women. And so that's why I would say, if you do have anxiety and depression, and you know that you've had it for quite some time, when you go to your doctor, let them know and say, I heard that there's a study. Can you also check me out for cardiac risk factors, such as high blood pressure, elevated cholesterol, and diabetes? We know that young women and midlife, let's say those are women that were typically thought of as being protected because of elevated estrogen. Even they are at risk. And so if you have anxiety and depression untreated, your risk is almost the same as a man's risk of heart attack, even though, we generally, younger women have the lowest amount. Premenopausal women have the lowest amount of cardiac disease. So just don't dismiss it. If you are having palpitations, at least get a baseline, so you'll have everything assessed, so that if you were to have symptoms, your doctor can say, okay, it's fine. One question had come up about, if I, how do I know it's not OCD? And someone else is asking about intrusive thoughts. And that's where having, a therapist and also primary care doctor, if they could ever be in conversation, if needed, with each other, sometimes that can be helpful. The benefit of when you're working in a program like we did is that all of the patients were all on the same floor, and it's not the same in private practice. But at least you're able to say, what are the parameters? Like, for example, a patient of mine was her daughter, was like a year and a half old, and she had really high fever. So I said, what's helpful is when you go to the pediatrician to ask, what are the parameters for me to call you? For the same thing, you would do the same thing with the doctor. If I had a patient whose husband had a blood clot. He got treated for it. Now she's like, he has a cough. How do I know it's not going to be another blood clot to the lung, a pulmonary embolism? So I said, all right, can you participate in that appointment, since you're like the caretaker in the situation, and make a list of, if it's a fever, if it's a cough that looks like this, so I think if it's OCD, that's an illness and can need to be treated independently. But if it's about my health anxiety, find out what are the parameters for which you need to come back and call.
Yeah, and I think that goes to just also education, right? Like educating ourselves. Once again, we're the best experts of ourselves, but we also have to be advocates for ourselves. So educating ourselves and understanding these things, like ask your doctor, is this normal for me? Like they have your chart, they have your labs. I also really encourage people, I do this with all my clients, but if your therapist or your mental health professional or behavioral health professional doesn't do it, you can ask, can you touch base with my primary care? You would just have to sign a release form and they can, and they can talk together and kind of be on the same page and the same team, which is really important. But it's important for you to know that. And I would also just to take that one step further, because I know we had a question in terms of like, when is it serious enough, so to say, or when should you be concerned to go to the hospital, to go to your doctor? And so there's that first layer of like, understand you first, right? Like, is this your normal? Like maybe this is health anxiety or this is anxiety. And you're like, okay, this feels like what it's been feeling like. If it feels more than that, if it feels more sudden, if it feels worse, if it's, really bothering you, if you can't breathe, if like it feels more extreme than normal, then I would say that that's a sign, or if you feel in danger of harming yourself or others, that's always a sign to call 911 or go to your local emergency room. But oftentimes, and I had a client, actually, it was a friend's child, actually, now that I think of it, who thought, this was the first time they were experiencing an anxiety attack or a panic attack and didn't know. And they went to the hospital and they got checked out and everything was fine. And they reassured them it was anxiety. And I remember I was telling my friend to tell their child, I said, well, now they know like those symptoms, so like sometimes you have to go or ask those questions and then you get the reassurance like, oh, now I know that wasn't, something more severe than that. I don't know. That's new. But that I think is the scary part of this during this time is that it's all new. Right. The first time it happens, it's so sudden. You're like, what's going on with my body? And that's where, go to your doctors, ask the questions. And that's really important. And I know you probably have to hop off as well. So I don't know if we want to stay on for a few minutes, I can kind of wrap up. If you want to, add anything before you leave.
No, this is great. Yeah. No, I just want to say, I echo everything that you said in terms of like being agents of change and recognizing that you need help and asking for it. And it's been a wonderful conversation. I'm so glad that we got to connect. And I hope that the community, that we all got to connect. We're both on Instagram. I'm Dr. Sue Varma, the word Dr. DOCTOR, Sue Varma written out. And you can learn more about me and my book, Practical Optimism. I hope you guys can catch a copy of it. And thank you to the Perry community for having both of us. And lovely. Thank you.
Yeah, thank you so much, Sue. And we'll be in touch later. And I'll just wrap up and share how people can reach out to me as well. So thank you. Enjoy the day.
Thank you all.
Thank you.
Thank you.
All right. So, and for everybody that is still here, in terms of how you can find me, I'm also on social media as Dr. Rachel NYC. Doctor is not spelled out like it was for Sue, just Dr. Rachel NYC. And I always say Instagram, social media, etc., is not therapy. This also is not therapy, what we just did, but I'm always happy to point you in the right direction, give you resources, connect you with somebody. If I know somebody in your area, I get messages all the time and I try my best to find resources for you in your area. If it's finding a therapist or a psychiatrist or another professional as well. So I really hope this was helpful. And just as a few quick reminders as we wrap up, I want to also just kind of summarize and remind people, if this is new and different, seek help, okay? If you're questioning, should I go to therapy? Should I see a mental health professional? Should I see a professional? I always say, if your thought is there, like you're questioning, should I? It can't hurt. Worst case scenario, you go for one consult or you have a call with somebody and you're like, oh, all right, this seems normal. I'm doing okay. Therapy can be beneficial to everybody, though, if you have access to it, things like that. But if you're thinking about it, it can't hurt. The times that I would say definitely you would want to go is if your symptoms are impacting your daily functioning. So, and we didn't mention food and nutrition earlier either, but I did want to mention that as well. To, like kind of eating regularly throughout the day, looking at your nutrition can be really helpful as well. That can impact how we feel, our mood, anxiety. But if it's impacting your daily functioning, if you have had a low mood, feel really anxious for more than a few days, we all have bad days here and there, but it's been more than a few days, that's also a sign that it might be time to seek professional help. Of course, I want to just mention it, but I hope many people know, if you have any thoughts of hurting yourself or ending your life or hurting somebody else, definitely a time to seek professional help. Call 911 or go to your local emergency room. And like I said, you can always start in a place that feels safe. So maybe that's your gynecologist, maybe that's your primary care physician. You can always ask them, I've been feeling this way. Is that normal? Is that normal for me? What's going on? Can you check my hormones? Can you check, different things? So that sometimes is a safe space for people if you have a doctor that you trust and you've been with for a while, before maybe reaching out to a behavioral health or mental health professional as well. So sorry, I live in New York City, so if you heard that, that's just normal noise here. So we're going to wrap up. As a reminder, both Dr. Sue and myself are available on social media. Thank you so much to the Perry community, to the Perry team, and for all of you for showing up today. Once again, this is an act of self-care, and we are here for you. So please feel free to reach out. And thank you. I hope everybody has a mindful day and a beautiful weekend. Thank you.